The Secretary of the U.S. Department of Health and Human Services, Alex Azar, has renewed the National Public Health Emergency Declaration. The extension is for an additional 90 days, effective as of January 21st. So this takes us into the middle of April 2021. This is the fourth time the U.S. Department of Health and Human Services has extended the National Public Health Emergency since one was first declared back in January of 2020. The extension means that changes will continue. Changes to state Medicaid programs, changes for providers, and changes to the way some of the funding is handled to support some of the extra services needed during this time of crisis. Again, with some of the changes we've been covering over these last several months are changes to some of the requirements of insurance coverage. Insurers must cover COVID testing without cost sharing. That change will continue into the middle of April. Also, increased federal Medicaid matching rates for states that are complying with the requirements that go along with that. Also, for some states, this means you can't terminate people from your Medicaid program. Those changes, again, will continue. There are changes that continue in terms of Medicare inpatient payments for COVID patients. Also, some waivers of certain telehealth restrictions, allowing providers to bill Medicare for telehealth services and more providers to bill for services that are considered audio only. So more people can get access to doctors without having to be physically present in the clinic or hospital setting. There's also the waiver of certain reporting requirements for hospitals, knowing that many are very overwhelmed with COVID patients and might need a little bit more time for some of that regular paperwork. Here in the state of Wisconsin, there are some changes in the Medicaid program that continue. Not only that maintenance of effort, that keeping people enrolled in Medicaid and not terminating them into the near future, but also changes to not charge premiums in our Medicaid program and not ask questions about treatment needs, other requirements that would have been on the books that could be seen as limiting to the Medicaid program. Renewals and health coverage programs will also continue automatically in the near future. Secretary Azar said when signing this renewal, our work to combat the virus will continue, as will our work to ensure a peaceful and orderly transition. And of course, he is talking about the transition of power to a new president and a new administration. In the description below, you can read that renewal from the Department of Health and Human Services. We also give you the source of that quote.